Hi again, this is Dr. Joel Singer. I'm going to share some of my own treatments and some knowledge that I have accumulated over the past few years. I'm doing this because, number one, I'd like to educate the public, and also I am basically talking about what I've done for myself. And if you want to follow this, it's fine. I'm giving you the information so that you can make an informed decision. So here we go. I'm going to emphasize diet and exercise again, and rest and relaxation, because I think it's so important to your general health, and it has an effect on everything else. So we're going to talk about that for just briefly. Caloric restriction, I believe in that 100%. Limit the carbohydrates in your diet and do some intermittent fasting, and you'll lose some weight, and you will straighten out many of the medical problems you already have, such as obesity, hypertension, diabetes. Caloric restriction actually improves all of those medical conditions, but the other thing that a lot of people are not aware of is that it actually helps strengthen and stimulate your own stem cells. And this becomes extremely important as we age. Rest, relaxation, extremely important, recharging the batteries. And it turns out that sleep duration has a definite effect on longevity, and there's no question, too much sleep, not good. Too little sleep, not good. Just right, good. So get your 7.5 hours of sleep and make it a ritual, make it something important in your life, because it is important. I think sleep is more important than exercise. How do you like that? But the bottom line is, what are the relationships between dietary restriction, caloric restriction, and rest, and how does this affect your health in general? Well, the bottom line is it affects your stem cells. And stem cells are basically how we heal and what happens as we age. Okay, in a previous video, I talked about frailty syndrome and how stem cells actually help people who are basically dying of deficiency of stem cells, how it actually gave them back their lives again. So in this case, we're talking about orthopedics. Now, I fully respect my orthopedic colleagues. I think they do a great job with many, many bone and joint situations. However, I think that some of the thinking that we have about orthopedics has to be, how should I say, looked into, because we don't have too many choices. If you have knee pain and it continues without any help, you go to the doctor and he says, oh, okay, you can take some pills, take some ibuprofen or Tylenol, see what happens, and maybe the pain gets a little bit better. But usually within a few months you come back to the doctor and say, listen, this is hurting, it's too much, and you get some x-rays, maybe an MRI, and then what does the physician do next? Usually inject some steroid into the joint. Steroid works. Okay, there's no question it works, but it's very temporary and it's counterproductive because it actually causes destruction of cartilage. So why would you put something in your joint that eventually causes destruction of cartilage, even though you get a temporary pain relief? Well, that's the problem. Okay, so then we have the hydrogel and arthroscopy that's often done to try to find out what's wrong with the knee, and a diagnosis is made. But the bottom line is, even those treatments are not that effective, because eventually the knee starts to hurt again. And it's the inflammatory process. But how do we deal with the inflammatory process? That's the problem. So there's a treatment. I think it's becoming much more accepted as a standard of care, and that's PRP. Now, what is PRP? PRP, you take a patient's blood, you spin it down, you get these red cells, you get rid of these, and what's left over is plasma, and the bottom 1/3 of the plasma has a concentration of platelets in it. This can be injected into an inflamed tendon, a joint, anywhere in the body. It's your own cells. You're not going to reject them. However, there are differences in technique. And if you use just what I just said, a simple spinning down technique, you may get some results, but you're not going to get really good results. You really have to use a very high concentration of platelets, at least 5 to 6 times normal. And then when this is injected into a joint or a tendon, an area of inflammation, this actually works, okay? And you get relief. And there's no question, there's been many scientific analyses. Here are some papers that we have, meta-analysis, randomized controlled studies, and the evidence very simply is that PRP works better than saline or better than steroid injections. And it's natural and it's safe. And you can get relief up to 1 year with PRP. Many people have to have more frequent injections. It's relatively inexpensive, and it works to some extent, and it's beneficial. However, there's other evidence out there that there are better treatments, longer-term treatments, using stem cells. As we mentioned before, the stem cells can come from umbilical cord, as long as they are viable. It can come from bone marrow and adipose tissue. These are the 3 most common sources of stem cells. And there are also quite a number of randomized controlled studies that show the benefits of injecting stem cells into joints, especially, let's say, the knee joint. In this case, the control is the red line, and you can see these 2 other lines. One is a double injection, 2 injections. One is 1 injection. Whether it's 1 or 2, you're going to get pain relief. This is a pain scale reduction, and this is another measurement. And again, here's the control in the red, and the 2, the green and the black are 1 or 2 injections, and you can see that there's definitely an improvement in the pain. There's also in function and in general. And my own personal story is I've had knee arthritis, and I've had stem cell injections for that, and I'm improved, and that was 4 years ago, and I haven't required anything since. And there's lots of benefits from having your own stem cells injected in your knee, and I think these are outlined in this paper. All these papers, by the way, are summarized below. And by the way, if you like this video and you're still on and you still haven't gotten bored yet, please hit the like button. It really helps. And also subscribe to my channel, because I'm going to have a lot more of these things to say. So here's a comparison of adipose, bone marrow, and synovial joint, in other words, joint-derived mesenchymal stem cells, and how they benefit cartilage repair. And again, cartilage is not as simple as people think. The surface is chondrocytes, but down below there are other types of cells. And again, to restore function in the joint is not that simple and not that easy, but I do believe that it can be done with stem cells. And the stem cells work in different ways. First of all, they can convert to other cells. So if you have MSCs, mesenchymal stem cells, they can become bone, fat, and also cartilage cells. But in addition, they also secrete growth factors. And growth factors are similar, but actually in more quantity than what you get from PRP. So when you have PRP, you're getting these growth factors, but stem cells actually secrete many, many more growth factors. In addition, we have actual connections between the stem cells and the target cell, where actually mitochondria are transposed into the target cell. And I would say probably the more interesting and probably the most effective way that stem cells work is through the exosomes. And exosomes are packets of information. Either way, the intra-articular injection of either bone marrow MSCs or adipose-derived stem cells will have definitely an effect on regeneration of cartilage in the knee. And here's some more papers. And so exosomes, just briefly, exosomes are the information packets that are secreted by stem cells, and that's how they have their effect on the target cells. And there are different types of exosomes. In this paper, they're talking about exosomes from embryonic source. This might be a little more controversial, but you can get exosomes from umbilical cord or adipose-derived stem cells, or any other type of stem cells. These are the packets of information that stem cells use to communicate. I appreciate everything that people are listening, and if you need any more information, look down below. Also, press the like button and subscribe to my channel. Thank you so much for listening.